So good afternoon. I am Betsy Humphries, Deputy Director of the National Library of Medicine, and on behalf of the fabulous multidisciplinary staff of the National Library of Medicine and the Friends of the National Library of Medicine, I'm welcome to all of you. We are really, both those of you who are in the room, and we think we have a lot of people watching us, the video cast across the country, maybe around the world as well. So we are delighted, however, that so many distinguished guests have traveled here to be with us, some over long distances. And I would like to extend our special welcome to Lois Flatley and a number of Patty's sisters, brothers, and other relatives who were able to come with us. We're particularly delighted to have them here. I think that NLM is very rich in its advisors, partners, and supporters, and I'm going to acknowledge just a few of them who are here with us today. I can't possibly acknowledge all of you. But first, Bob Greenis, who is chair of the NLM Board of Regents. We have a number of other regents, both present and former, with us today, which is great. We have Barbara Redmond, president, and Glenn Campbell, chair of the board of the Friends of NLM, and a number of other friends in the room. We have Teresa Knott, president, and Kevin Baliozian, executive director of the Medical Library Association, and a number of other leaders and partners and supporters, including in our national network of libraries of medicine here today. So thank you all for being here. And I believe we have Doug Fritzma, who is the president and CEO of the American Medical Informatics Association. NLM has not only many partners around the world and out in the field, but we have a lot of great partners across federal agencies and, of course, here within the NIH. And we're very glad that I think Susanna Fox, who is the Chief Technology Officer of the HHS, is here. And I think perhaps also we have John White, who is the Deputy National Coordinator of the Deputy National Coordinator of Health Information Technology, and from right here at NIH, Gary Gibbons, who is the Director of NHLBI, and Pat Grady, who is the Director of the National Institute of Nursing Research. And I have to say, within here, we really welcome the very large number of nursing leaders from across the country who are with us today. Thank you all for being here. So, and we have Francis Collins, the director of NIH. So today is definitely a day for looking to the future, but I'm going to take a few minutes to set the stage by reviewing some historical milestones that have brought NLM to its current position within the world of biomedical and health information and data. As it happens, 2016 is the 180th anniversary of the establishment of NLM's earliest predecessor library within the Office of the Surgeon General of the Army. And 2016 is also the 60th anniversary of the passage of the National Library of Medicine Act, which in 1956 transferred the Armed Forces Medical Library from the Department of Defense into what was then the Department of Health, Education, and Welfare. And in addition to renaming the library, this act, which was co-sponsored by Senators Lister Hill, you're here today, and John F. Kennedy, gave NLM its great mission, and I'm going to read this to you, quote, "To assist the advancement of the medical and related sciences and to aid the dissemination and exchange of scientific and other information important to the progress of medicine and to the public health," end quote. Let me hasten to add for this audience that the Act explicitly defined medicine and medical to include preventive and therapeutic medicine, dentistry, pharmacy, hospitalization, nursing, public health, and the fundamental sciences related thereto, and other related fields of study, research, or activity. In addition to enumerating the basic NLM functions that support permanent access to the world's biomedical literature, the law also requires the library, quote, "to engage in such other activities as the Secretary determines appropriate. So in the 1960s, the scope of NLM was radically expanded by both the Congress and the Secretary in terms of adding grant authority, creating our first intramural research division, the Lister Hill National Center for Biomedical Communication, specifically in joining us to create a toxicology information program, transferring the Public Health Service audiovisual facility to the National Library of Medicine from the CDC, and I could go on. The scope of what we do, and particularly the addition of our grant program in 1965 and the requirement to create the National Network of Libraries of Medicine just radically expanded what the library did and set the stage. The programs that came out of those expansions set the stage for the next big set of expansions, which began in 1988 with the legislation that created the National Center for Biotechnology Information within NLM, acts which also expanded our activities in health services research, general assignments to the government, but also to NLM in terms of clinical trials registration, and to the NIH in terms of public access. I think that I always say that February 2000 was one of the great months in the history of NLM because it was the month that both PubMed Central, our public access to our public archive of articles in biomedicine, but also clinicaltrials.gov debuted that same month. So I think that we later were assigned responsibilities by secretaries in areas related to health data standards and health services research. And we have arrived today with a very wide-ranging set of activities that affect virtually all aspects of biomedical information and health data in some way, shape, or form. And Patty comes to us now as the 19th person, the first nurse and the first woman to officially be appointed as the library's director. The first appointed director was actually John Shaw Billings. Before that, there wasn't a director. He was appointed in 1865, and as many of you know, he was then actually purposely transformed the Library of the Surgeon General's office into a national medical library. He established the Index Medicus and other cataloging and indexing things that are a precursor of PubMed today. He was also involved in greatly expanding the collection. So when he left, we were the largest medical library in the world, as we still are today, and established many of our nationwide services. So Patty, if we move forward to the modern era, is just the fourth person to serve as the director of the library since it has been named the National Library of Medicine. And I have had the distinct pleasure and privilege of knowing all of these great leaders and working for and with three of them now, including Patty. In my view, they all represent exactly the right choice at the right time. In the case of Patty's three predecessors, each prepared the way for the next person, in essence, transforming the National Library of Medicine and its directorship into a job that would appeal to the next person. We are all fortunate that Don Lindbergh's expansion of NLM's programs in scientific data, electronic health records, public health, services to patients and the public have made this job attractive to Patty Brennan. So it is my great pleasure to introduce Patricia Flatley Brennan to present her first public remarks as the director of the National Library of Medicine. Patty.
Wow. I feel very welcomed. And I want to thank you all for giving up this finally beautiful afternoon in Washington, D.C. to come inside. I'm delighted, honored, and just absolutely gratified to be standing here as the 4th director of the National Library of Medicine in a line of 19 important leaders. But none has been more important than Betsy Humphries, who took the responsibility for a 16-month period to transition, to continue to accelerate, and to bring the library to a place that it needs to be. And I thank her so much for her work. I also want to thank the audiovisual program development branch and the communications team for this tremendous afternoon. It's going to be a great time. They've worked very hard, and they've spent an awful lot of time preparing materials to help you understand what I am now learning about. I've been here 3 weeks. I think it's appropriate to start a little bit to introduce myself to you. Some of you I know, many I'm starting to get to know, and some I've lived with for quite a while. I am a mother of Connor up here. I am a daughter of Lois and Tom. I'm a sister to my siblings and a friend and colleague, I hope and trust, to my friends, those here present and those around the world that I've had the privilege of working with. For the past 30 years, I have blended 2 professions, nursing and industrial engineering, in the service of people living at home, learning to take care of themselves, coping with complex problems. Nursing brings to this challenge a fundamental, unique focus on the person, on the diagnosis and treatment of human response to disease, development, or disability. We are concerned about the response to fundamental pathologies and trauma. We bring something no one else brings. Industrial engineers bring a focus on technological solutions to complex problems. So what a great mix this was. Now, my focus has been primarily on reaching into the home, which is not a place you usually see industrial engineers. And the challenge of reaching into the home brings us into a place that's intimate, private, unstructured, and the place where most health occurs. We spent a lot of our time visiting homes. We've been in over 1,000 homes in Wisconsin alone, and we learned many things from that. But fundamentally, we learned that people don't like engineers and nurses traipsing through their bedrooms. So we had to find a better way to bring our understanding and our solutions to those in need. We developed, through the techniques of virtual reality and 3D rendering, the opportunity to recreate households as point clouds, and then study them in depth in virtual reality caves, and then begun to learn things such as health occurs all over the house. That little pillbox that you carry with you actually has to fit in your pocket. It doesn't do any good if it just sits on the counter. And in fact, sometimes health occurs in the middle of the night when people feel the most private. So as we build tools and technology to deliver information into people's hands as they need it, we have to think about where they are. But thinking about where they are and thinking about the home leads me to tell you a little bit more about my family for a few minutes. It's quite a family story, maybe a myth, that the 7th son of the 7th son will be King of Ireland. Now, our dear dad was the 7th son in a large Irish Catholic family, and he met our lovely mother, and they looked forward to starting on the dynasty. And they began, and first there was Jean. You'll meet these people this afternoon, most of them are here. First there was Jean, and then there was me, and then Kathleen. This was not looking very good. But then our brother Kevin came along, and our brother Tim, and hope had returned to the family, and then all of a sudden, Eileen, but then Brian, and then Sean, and then Tom. Things are looking better, but then Bridget, and then that's what we had. So there were 10 of us, and there was no King of Ireland. So I'm here to say, what exactly is there for the second daughter of the 7th son? And it is the opportunity at this point in my career, at this point in our lives, at this point in society, to work with this amazing group of 1,700 professionals and colleagues and employers and librarians and patients around the world to bring information to the point of health and information to the point of need. So in my remarks today, I'm going to do 3 things. We'll be drawing from our history. We'll be doing a lot of celebrating of our present, and I'm going to ask you to work with me some to anticipate our future. Betsy remarked of the importance of John Shaw Billings to us, who brought the idea that information came from the past and yet comes into the present to have the library be a dynamic interplay of medicine and information, so that in the year 2000, Don Limber could create a network around the world that anywhere where people were, there was electronic access to the information needed for medicine. Some of those who helped shape this program are in this room right now, and I'm grateful for what you did. One of those is leaving next week to go back to Africa. We are continuing to focus the resources of the National Library of Medicine around the world, recognizing that we draw from our past and it becomes a vibrant present for us. The goal is to make sure information is available everywhere and assure that that information is meaningful and useful at the point of need. So let's take a look at some of the things we've been doing. The National Library of Medicine is first and foremost, has as its vision to support discovery. Our vision is to support discovery. And we do this in two primary ways. The first way is to examine, explore, and cultivate and expand the basic biomedical information sciences and library sciences to make sure that the tools needed for you to be able to take care of yourself bring information that is actionable, meaningful, understandable, useful to everyone. But we also provide the knowledge platform for biomedical science discoveries. We accelerate the ability of talented and smart investigators to understand their phenomenon, to communicate it to others, and to learn and to realize in faster and faster ways. Right now, we run a research and training program in our extramural area, and I'd like to focus on two candidates from each of those areas to tell you about what we actually do. Emily Mallory is a graduate student, a PhD student at Stanford University. Her work is to study large-scale extraction of gene interactions from the full-text literature using Deep Dive, a natural language processing tool. There's lots and lots of information out there. It's growing too quickly for human minds to read. So Emily's work is going to help us extract from the literature these interactions and categorize them and make them accessible for other workers. Justin Maurer, who is at Rice University, is trying to improve drug safety by using data mining techniques to mine the vast literature we have at NLM to first discover interactions. No one can read all of the articles we have here. Maury's work is trying to help us glean from information from there, using some of our text processing and representation tools to be able to make this information accessible to machine learning algorithm. So he's not simply going through and cultivating did researcher A find result B, but he's going through and trying to map how often certain patterns emerged, what were precursors, and how we can better understand them. These are our young people, our pre-doc and post-doc trainees, and we're very proud of them. We have 14 programs around the country to train pre-docs and post-docs. In addition, we run a range of extramural programs, both research and extension. I'm going to point out two of our researchers. Scott Maurer, who is a new investigator, has an award where he's at Arizona State University, by the way, in Tempe. He's looking to merge viral genetics and climate and population data to be able to understand human, animal, or zoonotic disease and zoonotic surveillance. So he's trying to bring together ideas about how the climate around you, the experience that you have, and the population that you're living with can make or influence your ability to be susceptible to diseases. In addition, Elizabeth Chen at Brown University, she's looking through the electronic health record, trying to better understand family linkages as we learn about heritable diseases and also as we learn about the adult health effects of childhood exposures. Understanding a person not as a point in time, but as a life flow is essential, and our investigators are building the tools that allow us to do this. And again, I'm extremely proud of them. We also, though, in addition to building tools, we reach in and archive and present history to the world. Our History of Medicine division recently presented an installation called Confronting Violence. What's important about this program isn't only that we understood aspects that contributed to the understanding of violence, but how health professionals developed policies and procedures that enabled them to manage, to understand, to detect violence in a person. They needed to bring together what we would call the gray literature, meeting notes from hospital meetings, small guidelines from institutions as they began to understand and confront this problem which we now know broadly as violence and intimate partner violence. Without aspects, without explorations like that, we would not, first of all, be able to call the public's attention in a meaningful way to how knowledge builds, but more importantly, we would not be able to document how knowledge builds. This is critical for us. The National Library of Medicine accelerates and plays a critical role in shaping the federal policy on open science. We developed the first model open access strategy that has now been adopted by many federal agencies, in which the research findings built on federal funds, your tax dollars, are made available quickly and broadly and without restriction to the general public. We have also worked to make sure that their vast resources of the National Library of Medicine are available through open APIs, open application programming interfaces, so that others who want to build tools upon our work are able to do that. So we export not only access to the knowledge, but tools to help use the knowledge. This is a great thing. Recently, we've begun to take up the federal challenge, the federal government's America Creates charge to create challenges. The National Library of Medicine Image Recognition Challenge was a way to engage citizens in science, public data available for scientists and lay people to improve patient safety. And the basic question that was asked was, can your cell phone tell what pill that is? This could be useful. Can a cell phone tell what pill it is? Can help an individual family member in the middle of the night trying to understand, what was that pill that my kid swallowed? What's going on with me? What do I need to do? And our first prize winner came from a team of students at Michigan State University. They were able, given a training set of 7,000 images and 1,000 testing images, to identify 75% of the pills accurately. What we're learning is how to take emerging technologies, cell phones, simple smartphone technologies, and use that to help people better their own health at a point where they need to be and where we need to support them. We are also trying to improve healthcare. We ultimately do not give care, but our standards of terminologies, our human factors understanding of teams, our delivery of disaster information in the moment, all allow us to ensure that the information needed by health professionals at the point of care is available there, and secondarily, that that information flows into a larger and more complete understanding of all of the kinds of practice-based interventions that lead to an improvement in the health of our populations. Watch with me for a moment while we celebrate our present in the work going on here at the National Library of Medicine. This is a great place to work. The accomplishments of the colleagues and the directors and the managers and the staff that have gone before me provide a basis for us to know that we can develop the resources needed to help meet the challenges of the world. I want you to anticipate with me for a few minutes what the future may hold for the health of the population, for the health of your family, for yourself. It's important for us at the National Library of Medicine to think about what challenges lie ahead in healthcare, because we need to be ready with the information, resources, and supports needed to either help discover and characterize them or to sufficiently bring information to be able to assist with them. Now, you all each have your own 3 or 4 top healthcare concerns of the moment. And if you don't, I ask you to take a minute right now to think of them, because they are what drives us to create the information tools to be responsive. I'd like to call 3 to your attention. First, the genetic discoveries of the last 20 years have heralded a promise of precision medicine that now may be realized. So we may know not to give you codeine because you lack the gene that converts the enzyme that makes the codeine pharmacologically accessible to you, or it may be better to treat you with a certain approach to your cancer than what was originally thought based on your symptomatology. But it also requires us that we help every person understand this complex, twisty genome inside of them, and ways to do that that reach across the literacy lines, that reach into the everyday schools of children, that reach to my mom, are part of our purview. Second, infectious disease remains hugely problematic, and what we're learning more because of our work here at the National Library of Medicine is that mutations occur quickly and differentially across the world. Understanding how those mutations are occurring, when to anticipate where they might be emerging, will allow clinicians to better respond to them. And finally, we must mention chronic diseases, asthma, diabetes, hypertension. They continue unabated, and they're in some ways growing. And while I have been a part of the community that has said, let the patients participate, for they will help us, I also recognize that good intentions is not enough. Powerful information, effective information tools, good surveillance are also necessary. So chronic disease management, which will remain a partnership between professionals and patients, has a third leg of that stool that I think of as the National Library of Medicine. As we think towards how we will help, what will we do? The National Library of Medicine has certain things we can do and certain things we can't do. I'm going to bring forward 3 challenges that I hope we'll be able to do. We don't do surgery upstairs, and we have no blood banks here. But we can begin to take a lifespan and a life flow approach to understanding complex chronic diseases, to understand the consequences in adult health of childhood exposures, and begin to think of health not as a moment in time, but as a process across time. That requires us to rethink how we index. That requires us to understand sequential and versioning activities. That requires us to understand information as an interaction, not as a delivery mechanism. Second, we can support the creation of a learning health system that better leverage data to better foster effective health care. We can do this by improving the dissemination and use of standard ways of expressing healthcare problems, of assuring that your headache in New York is described in the same way as your headache in California. But more importantly, is the computational models that underlie that are available and accessible and can be applied to information. And finally, I believe that we can continue as a library to do what we've started over the years, which is enabling improved treatment and better self-management by harnessing technologies. We are not the National Heart, Lung, and Blood Institute. We're not going to understand and discover the basic physiology, but we will be able to provide tools for understanding, for accelerating that understanding, and for people to take action on them. So now walk with me as we anticipate our future a little bit. What should the National Library of Medicine do? Well, one of the things I've learned in the first 3 weeks that I've been here is that the director doesn't have a whole lot of say over this, but the director can shine a spotlight and provide a little direction and sometimes nudge with a little money, and that's where I will be spending my next few years. But remember, first and foremost, the National Library of Medicine is about discovery. And discovery in 2 planes. One is supporting the biomedical sciences discoveries, and secondarily, to understanding basic biomedical informatics discoveries. We need better natural language processing tools. We need the ability to have privacy-preserving algorithms to run our data on. We have the possibility to assist in the development of information, making it accessible to the millions and millions of people that reach us every week, and the millions and millions more computers that seem to be talking to our computers without any human intermediary. Our investigators who specialize in image analysis and exploration and in natural language processing are building new tools that we can now search on a squiggle. We can investigate and look for shapes rather than looking for words. This brings us great promise. It would be inappropriate and unresponsible to not address the importance of standards as we go into the next period of our work here. Standards have a way of making sure that information flows freely. Without information flowing freely, words can flow freely, but they can't be processed or understood. So to make knowledge flow freely, we need structured ways to represent it. Bibliographic standards tell us how to represent library catalogs. Information standards tell us how to represent, how to understand the experience of a person. Nowhere and never before has it been more important to have attention and systematic approaches to standards. And my colleagues who are in the audience or listening countrywide probably never expected to hear me say that. But standards are essential to the future. Why? Because the amount of information that's coming at us is flowing way too fast. And standards are one way to organize it, not the only, but one way, and we must continue to invest in these now. Allowing the genomic scientists to use an electronic health record to understand the phenotype is only going to happen if those records are accessible in a way that the genomic scientist understands them. So standards are us. Now, partnering is really critical for the National Library of Medicine's future. We are, just like BASF, we don't make the information, we make it accessible, useful, safe, stored, available, and curated. Our responsibility is to make sure that what scientists need, or clinicians want, or patients look for, can be gotten without a lot of barriers, without a lot of cost, and with a great deal of trust. The imprimatur of trust of our National Library of Medicine allows our partnering scientists to be sure that what we deliver them is accurate, is correct, and current. We must remember that this is a job that only the National Library of Medicine can do, and we do it really well. We have to continue to do this. The future is a future of data. The data will come from all sorts of places. Right now, we're most familiar with cellular molecular data, genomic data, and symptoms. But there's new data elements out there even now that tell us about the health of people, that give us a chance to ensure that we can get into their hands and to understand from their experience what's going on. Sound of a baby crying, or a family having an argument, the motion of a person walking after surgery. These are all data types that we've only just begun to explore. And our work in image technologies has got to expand to help us understand the fluid motion.
So good afternoon. I am Betsy Humphries, Deputy Director of the National Library of Medicine. And on behalf of the fabulous multidisciplinary staff of the National Library of Medicine and the Friends of the National Library of Medicine, I'm welcome to all of you. We are really, both those of you who are in the room, and we think we have a lot of people watching us, the video cast across the country, maybe around the world as well. So we are delighted, however, that so many distinguished guests have traveled here to be with us, some over long distances. And I would like to extend our special welcome to Lois Flatley and a number of Patty's sisters, brothers, and other relatives who were able to come with us. We're particularly delighted to have them here. So good afternoon. I am Betsy Humphries, Deputy Director of the National Library of Medicine. And on behalf of the fabulous multidisciplinary staff of the National Library of Medicine and the Friends of the National Library of Medicine, I'm welcome to all of you. We are really, both those of you who are in the room, and we think we have a lot of people watching us, the video cast across the country, maybe around the world as well. So we are delighted, however, that so many distinguished guests have traveled. So good afternoon. I am Betsy Humphries, Deputy Director of the National Library of Medicine. And on behalf of the fabulous multidisciplinary staff of the National Library of Medicine and the Friends of the National Library of Medicine, I'm welcome to all of you. We are really, both those of you who are in the room, and we think we have a lot of people watching us, the video cast across the country, maybe around the world as well. So we are delighted, however, that so many distinguished guests have traveled here to be with us, some over long distances. And I would like to extend our special welcome to Lois Flatley and a number of Patty's sisters, brothers, and other relatives who were able to come with us. We're particularly delighted to have them here. I think that NLM is very rich in its advisors, partners, and supporters, and I'm going to acknowledge just a few of them who are here with us today. I can't possibly acknowledge all of you. But first, Bob Greenis, who is chair of the NLM Board of Regents. We have a number of other regents, both present and former, with us today, which is great. We have Barbara Redmond, president, and Glenn Campbell, chair of the board of the Friends of NLM, and a number of other friends in the room. We have Teresa Knott, president, and Kevin Baliosian, executive director of the Medical Library Association, and a number of other leaders and partners and supporters, including in our national network of libraries of medicine here today. So thank you all for being here. And I believe we have Doug Fritzma, who is the president and CEO of the American Medical Informatics Association. NLM has not only many partners around the world and out in the field, but we have a lot of great partners across federal agencies and, of course, here within the NIH. And we're very glad that I think Susanna Fox, who is the Chief Technology Officer of the HHS, is here. And I think perhaps also we have John White, who is the Deputy National Coordinator of the Deputy National Coordinator of Health Information Technology, and from right here at NIH, Gary Gibbons, who is the Director of NHLBI, and Pat Grady, who is the Director of the National Institute of Nursing Research. And I have to say, within here, we really welcome the very large number of nursing
Investments will be complemented by listening sessions to the challenges, the NLM's response to those challenges, and those listening sessions will involve the NIH as a community, will involve the biomedical informatics and library science communities, our primary stakeholders, and the population at large. It's a lot of people to reach, and we're going to look for a lot of support with this. And finally, we're going to be evaluating our physical plant because, yes, our computers are great and our books are beautiful and there's many treasures, but sometimes our stairways are dark and sometimes our rooms leak, and we need to attend to that. So we will be complementing a visioning of the future, a functional audit of our current activities with an understanding of what is needed to make sure that the National Library of Medicine remains the jewel in the crown of the NIH. I thank you for this opportunity, and I trust you'll keep in touch and work along with me and my colleagues as we make this happen. Thank you.
I'm sure that you all can understand why I was terribly enthused when I heard that Patty would be our next director, and I've become more enthused with each passing day that she's been here for the last 3 weeks, so it's been great. Now, it is my pleasure to introduce the director of the National Institutes of Health, Francis Collins. He has many achievements and he's done many great things, and as I think you can all tell, one of the greatest things he's done recently is appoint Patty Brennan as director of NLM. Thank you, Francis.
Well, I agree with that. Patty, wonderful remarks, inspirational, walking us through where we've been, where we are now, and especially where we are going. And I think we all share the excitement that you have conveyed. And we're on your team and want to make this dream turn into something really spectacular. And you're just the right leader to make that happen. Also, really want to say thank you to Betsy Humphries for her wonderful leadership over these 16 months, keeping the NLM on a very remarkable course. And all the things you've done for NLM before that, as you outlined all of the many other folks you've worked with here and the leadership you have shown. You have been a wonderful, dedicated public servant, and you have made this place really wonderful. So thank you for that, Betsy. I often say that NLM is NIH's window to the world. This is an absolutely critical part of everything we do. Most of those people out there in this country and in other countries who know something about NIH and seek information from NIH, they come in through this portal. And this portal has been remarkably well designed to serve those needs. And yet the challenges are growing almost by the hour. Maybe we shouldn't be in here spending time. We should be out there figuring out how to make NLM better. But we'll get there. And you have the right leader to make that happen. So we can stop for a little bit and celebrate what's been accomplished and think hard about where this needs to go next with this new leader. This is a great day, I think, for NIH to have the opportunity here that I will in a moment of swearing in Dr. Patty Brennan as the next director. You can hear from her vision that she's already on the path to thinking about doing great things here. No one knows better than I the challenge of trying to find leaders to come and be part of our senior visionary group at NIH. And no one knows better than I what a challenge it is for an organization like NLM to find the right person with the right skill set, given the broad diversity of what this institution has on its list of responsibilities. So the task was daunting. How could we find in a single person the many talents and abilities needed to lay the groundwork for what you've just heard about, NLM's third century? But when we found Patty Brennan, I'm proud to say, we found the entire package. She brings with her this incredible set of experiences. And that includes having cared for patients as a practicing nurse. But she's got the tech side covered here extremely well, too, that industrial engineer attitude, but brought to a very interesting place, as you have heard, improving the lives of homebound patients by developing innovative information systems and services, and picking the opportunity to utilize cutting-edge efforts in visualization and virtual reality to add to that body of data. So putting all those skills together, I believe, makes her ideally suited to lead the NLM in the era of precision medicine, where we are increasingly trying to figure out how can science get together with this desire to empower individuals to be able to experience a better health span as well as a better lifespan. And the library is going to become more than ever the epicenter for biomedical data science, which is going to be the foundation of everything we try to do in precision medicine. And so there could hardly be a more important moment to have the right leader. And you can tell from what you've heard this afternoon that we were very fortunate indeed to recruit Patty Brennan. If that weren't enough in terms of the skill sets and the resumes, I'm also able to testify that Patty is a wonderful human being. You've just had a great example of her communication skills. She's also a lively presence on Twitter and is about to launch a blog to talk about NLM. But I have found in the brief time that I've been able to share ideas and talk about sometimes challenging problems with Patty, that her ability to sift through those issues and to come across with a view that is both nuanced and optimistic is exactly what we need in so many of these rooms where we're wrestling with these issues. So I think now that my Twitter feed is coming out rather nicely now with my 64,000 followers, I might have a run for my money here. Somebody who really knows how to communicate. We'll see how that all goes. So again, without further ado, because I know there's a reception and probably all of you would like to have a chance to extend your congratulations, and we also want to hear in a moment from the chair of the Board of Regents. But we have a special moment now, which is the swearing in. The oath of office, which I'm about to ask Dr. Brennan to read, is a historical document. It is the same oath of office that is spoken by every member of Congress when they come after just being elected or re-elected. It's the same oath of office that is recited by the Vice President, by the members of the Cabinet, by judges, although judges have another oath they have to do as well. They have double oath requirements. And all of us who have been at NIH have read this same oath some of us twice for different positions. So you're connected in this way through a long tradition. By the way, the president's oath is a little different. Maybe that explains why the Supreme Court justice stumbled over it a couple of years ago. We won't go back to that. But the oath that Patty's being asked to read has been the one that has held us all together. And it's a solemn moment, a moment that someone like Dr. Brennan, with all of her skills and all of her talents and all of her contributions, stating her desire to be a public servant to the people of the United States and to defend the Constitution. It is, I think, something we will all kind of be touched by and remember. And we're particularly fortunate here that Dr. Brennan's sister, Jean Flatley McQuire, is going to join us up here and hold a copy of the Constitution, which, if you read the program, is a special one, as the oath is administered. So, Patty, can I ask you to come up? And Jean Flatley McQuire also. And having done this a few times, I recognize that there's tape on the floor. And Patty, I think you should be there.
No, I think I'm there, and I think you're there.
Well, I might have to rearrange this.
All right. I tried already, and it didn't work.
Hey, I'm the director. So
Where do you want me, here?
I want you in the middle, Patty.
There you go.
There you go. And I'll be here, and
All
that
right.
way we have the
I
right.
My brother's
Clearly, we
laughing at
did
me.
not rehearse this. Okay, and there is this wonderful Constitution. And what I'm going to do is ask you to repeat after me, and I will go through relatively few words at a time, because otherwise it's easy for both of us to get mixed up. So may I ask you to put your left hand on the Constitution and to raise your right hand and repeat after me. I state your name.
I, Patricia Flatley Brennan,
Do solemnly swear
do solemnly swear
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United States
against all enemies,
against all enemies,
foreign and domestic,
foreign and domestic,
that I will bear true faith
that I will bear true faith
and allegiance to the same,
and allegiance to the same,
that I take this obligation freely
that I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and that I will well and faithfully
and that I will well and faithfully
discharge the duties of the office
discharge the duties of the office
on which I'm about to enter.
on which I am about to enter.
So help me God.
So help me God.
Congratulations.
Thank you.
Well done. Well done.
Thank you. Thanks. I needed that.
Well done.
Sit.
And now I'll introduce the chairman of the Board of Regents of the National Library of Medicine, Dr. Robert Greenis, and he will have the last few words.
Well, this is a very tough act to follow. And I'm standing between you and refreshments, so I'll be very brief. But I am representing the Board of Regents, and on behalf of the board, I want to extend our enthusiastic welcome to Patty as the director of the National Library of Medicine. This really couldn't happen at a more important time, I think. We've talked about the learning health system, and we're facing a number of challenges, political, financial, social, and technological, in trying to make that happen. And the library is uniquely positioned to capitalize on marshaling the science that's coming out of NIH and elsewhere, sharing the knowledge, and making it available and interoperable in order to pull together this very complex, multifaceted health system and healthcare system that we have in this country and in the world. So, recognizing the importance of playing a leading role in shepherding this complex process, the Board of Regents is working with Patty, as Patty mentioned, to launch a new strategic planning initiative and to engage the broad community of stakeholders in this process. So we're very excited, and I'm personally excited to be chair at this point in time of the board as this process unfolds, and with a new leader like Patty to help us to think through this and to implement our vision. I wanted to just add a couple personal notes. I think I've known Patty for some 28 years. I actually looked up, I think we were both invited to give a talk at Salt Lake City 28 years ago, and that's when I got to know her first. And since then, we've had the privilege of getting to know each other through multiple committees, joint working sessions of various things. We've had brainstorming sessions in some of our national meetings. And we've also shared some postdoc and student and junior faculty mentees that we've co-mentored. And what I've learned over this time and continue to be impressed by is Patty's insights, her broad perspective, her organizational skills, and ability to cut to the chase. And I think we've seen all this, and also her leadership. So the NLM, I am confident, is in excellent hands as we embark on this exciting future. Again, our congratulations and warmest welcome to Patty. And then I would like to just close with letting you know that the reception awaits, where you will have a chance to talk with Patty and wish her well, and also to inquire about the next steps. And I want to mention that the reception food and refreshments are provided by the Friends of the National Library of Medicine. So thank you.